Welcome to the Ambulance Suppliers Using the Modifier GY webinar. I'm Tom Ryan with Provider Outreach and Education, and I'll be your presenter today. Today I'm joined by Aline from my team, who's going to help you with chat questions. She's going to give you additional resources in the chat. Now, she may actually answer some of your questions depending on what you're asking. But we want to remind you that this is about ambulance suppliers using the modifier GY. If you would like to download today's presentation material, please feel free to do that. It is available on our website. It will be removed later today or tomorrow. It just depends on when it gets removed, and will be reposted when the encore presentation is posted. So you want to give us about probably 30 days to get that encore presentation up. So what are we doing today? Well, today our goal is to look at the ambulance claims and when you should bill a modifier GY, because ambulance claims have a different set of criteria than a lot of people understand, and it's based on the Social Security Act. So we want to make sure, one, you're doing the correct action, and if you've done that, should you do like an appeal or something else with it. We'll talk about that as we get through. So really we're trying to get your ambulance claims paid when or denied when submitting the modifier GY. The first thing I'm going to do is to define the modifier GY. Then we're going to talk about redeterminations and the issues that we're having with the redeterminations when an ambulance claim bills modifier GY. Last, we'll look at your question and answers. We'll do pre-submitted, and then we'll do some chat questions. Here's what I want to remind you. I will throw out pre-submitted questions throughout the event. So listen up. It's important to make sure that you understand, hey, slides weren't just randomly built. So here's our first piece of information as we get into what is the modifier GY. We do have some people that are brand new to Medicare. Now, they did register for this event. Whether they're on or not, I'm not sure. I haven't looked through the full registration. It takes time to compare that. But because they're new, I don't want to exclude the definition of modifier GY and some of the basics that go with using that for an ambulance claim. I want to make sure we're all on the same page before we get too far into anything else. So with that said, I will ask Aline if there are any questions at the end of this section. Again, I don't want to leave anyone behind. Also want to remind you that sometimes I'm going to use acronyms. They're on the bottom of the slide should you download them. But if you don't know what an acronym is, put it into the chat so that Aline can answer you back and get it right back to you so you're not lost as I'm going through the different pieces of information. All right. So what is a GY modifier? The GY modifier indicates the service is not covered by Medicare. What that means is that it is not a part of the Medicare benefit package. It's not a part of the Medicare program. It's never going to be eligible for payment, even if you argue that it's medically necessary. Now, for an ambulance transport, a modifier GY must meet the definition, so we're going to get a little bit more into that. But I really want you to understand that a GY also indicates that you did not tell the patient that it was not medically necessary. Instead, the patient is relying on their Medicare NU handbook, which is their official Medicare guidelines sent to them by the Centers for Medicare and Medicaid Services. So GY means no ABN was given, no information was given, like that's no official written document. That's what GY means. I was asked a very specific question, which we'll get into a little bit later to talk about when you do give one for this purpose. Okay, so that's what we know about GY. So what do we know then about the basics of the ambulance transport benefit so that you know if you should append a GY on it? Here's what we know. The ambulance transport benefit is defined in the Social Security Act, Section 1861S. 7. This means that unlike defaulting to just general medical necessity, there are certain criteria that must be met. For those of you that are not familiar with that section of the Social Security Act, it is linked, Section 1861 is linked on the bottom of your slide, and S7 is what we're looking at. Now here I've given you some basic words to kind of put it together in a nice, easy manner. So first, in order to meet the definition of a Medicare ambulance benefit, it has to be a transport. That means you have to load the patient and drive them to a covered destination. A transport has to occur. Also, it must be medically necessary by the term contraindicated. That's the actual term from the Social Security Act. What it's saying is that ambulance is the only safe means of transport. It does not state it is the only means of transport. So, for instance, it's 2 a.m. and there's no wheelchair van available at a nursing home. That does not make it contraindicated. It is the patient's condition that will do that. So, if the patient could safely go by any other means, even if it's not available, then it is not part of the Medicare ambulance benefit, which would indicate that when you bill it, you should use a GY. Someone asked me, why don't you use a diagnosis code to indicate this? And I think this person probably bills other types of services where diagnosis codes can do that under policies and other things. But remember, an emergency medical technician cannot diagnose. So therefore, we don't have a way of just simply relying on that. On the other hand, what we do have is what comes within the Social Security Act. Now, some of the information we're going to give you also is contained in the Code of Federal Regulations, and you can take a look at that if you're interested as well. I'm going to provide you a little bit of information on the assessment because the assessment is what proves that it is the only safe means of transport. Couple of things to keep in mind if you're interested. We do have a course next month just on ambulance documentation, the assessment in particular, and some different things like that. So I would recommend. This is a very condensed version of it, if that makes sense. It's just a few kind of highlighted pieces, but I could spend a full hour on this alone. So we want to make sure you know that. So an assessment. First, this is what supports the medical necessity or the fact that a patient can only go by the safe means of an ambulance. The assessment must be completed by an emergency medical technician at any level. Keep in mind, CMS does define 3 levels. Your state laws may define this differently, but CMS says basic, intermediate, and paramedic are all EMTs, just different levels, and they have different criteria. CMS relies on your state licensing to control which level is required to do it based on the patient's reported condition. So I want to make that clear. Dispatch condition drives which level of EMT can do this assessment. So when we look at the assessment, there's some basic things we do have to have. One, we do have to have the patient's identifying information. Question on this was given to me about matching the name exactly. If for some reason the name doesn't match exactly, please indicate that within a supplemental record, within a note, maybe right on there you can say it's Betty, not Elizabeth, whatever you want to do, right? Just indicate to us so that Medicare can figure out that it really is the same patient. When we say exactly, what we're asking you to match is the Medicare eligibility file. The assessment must also contain an observation. The EMT observation, what they heard, smelled, what they felt, what they saw, was asked about smell, and I always am. Think of alcohol, drugs, those are things that you smell. One of the ones that always sticks in my mind is infections like gangrene. They have a certain odor that may lead an EMT to look at something. So an infection at a high level could lead the EMT to say, oh, this person has really low blood pressure, this person has this person has this going on. That's what we're talking about with some of that. We also would like the EMT to document as part of their assessment any information they've gotten from anywhere. So the bystander says, yeah, you're not going to get anything from the patient because when we walked up, they were laying on the ground, which is why we called 911 and why you were dispatched here, right? The bystander may give you additional information. They could also say something like, hey, we saw this person walking. Okay, well, what happened? Well, they tripped over that edge in the carpet and fell down and now they can't get up, or maybe they're unconscious, or they're holding their hip, their arm, etc. That can all come from a bystander depending on what the patient's level of pain and ability to communicate is. What are we looking for when it comes to the medical skills? We're looking for why an EMT's medical skills are needed during the transport today. This could be needed for monitoring. This could be needed to, give injections. This could be needed for any of those types of things. But what makes that skill needed so that no harm is caused during this transport? It's a very general statement, but to learn more, come to that one next month. Then we're looking for signatures. You don't know about this. Whoever did the assessment, we need you to sign the assessment and then give us your credentialing. Hopefully that makes sense. That's what will prove medical necessity, is this assessment. Now, what happens, and we've all heard of this, you show up and the patient is walking around and you're like, what's going on? Well, you say, wait, this isn't a medically necessary transport, so I'm going to give an ABN. Now, an ABN is an advanced beneficiary notice of non-coverage. So why is the ABN not required when it is not medically necessary? When it's not medically necessary at all? And the answer is an ABN is required when it's a different section of the Social Security Act governing this. Specifically, it's not required when it's in Section 1861. So we wanted to make that clear, and the question hopefully is answered, but I do want to remind you that we will talk more about ABNs if you need to. So when you use a GY modifier, you should not be giving an ABN. You are relying on the patient information in the Medicare New Guidebook. When you do give an ABN for a service that is never covered, not a Medicare benefit, it is what CMS terms an optional use. When it is an optional use, you do not need to complete the entire thing. You complete the top down to the estimate. There's no selection of options. There's none of that. And you do have to use the CMS form R-131, and you want to make sure that you are using the one that was just updated. Okay. So I went through a lot of very, very fast information there. So an ABN is required and would be billed with a modifier GA when a service is medically necessary. So the EMT does an assessment and determines, yep, this is medically necessary. We do need to give an ABN because this service is going to be provided at a higher level than is required. In real life application, this occurs when an air transport happens, but a ground transport would meet the patient's requirements. So let me restate that again. An air transport happens, but the ground level is what is required by the patient's needs. So hopefully all of that makes kind of better sense and answers a couple of those basic questions. All right. I was asked if there are times when you don't really have to do anything with a GY modifier, or when should you really look at it? Well, again, you're looking at something that is never covered by Medicare. So there's no transport. Those of you in the industry might know that as a treat no transport, right? You treated the patient, but you didn't transport them. That is a statutorily exclusion, and that's 1861 S7 that excludes that. Also, it's not a state licensed ambulance. It is a wheelchair van or something else. That is not going to qualify. Okay? Taxis and ride shares, statutorily required transports. This one was one that we were asked on, so I put it in. They have a requirement that anytime 911 is called, their statutes require a transport. Well, that doesn't mean it's medically necessary, okay? So we want to make sure we're doing that correctly. I talked about a different means isn't available, and that simply means, hey, the ambulance is only means available at 3 a.m. or 2 a.m. or whatever you want there, okay? So that is very true. Also, on most cases, a physician's office is not covered. What is the exception to that rule? Because Medicare loves the exceptions. It is skilled nursing facility consolidated billing when they're in a Part A stay, and consolidated billing applies. Lots more on that. If you want a different course on consolidated billing, we'll definitely give you that. We have some available for you on YouTube channel where you can actually learn all about that type of situation. All right. So that brings us down to some of the basics that we have when we talk about the modifier GY. So let's move on. But as I move on, let's stop and see if we have any questions in the chat. Aline, do we have anything?
Hi, Tom. Yes, we do have a question from Christy. She says, do I add the GY modifier instead of using condition code 21 for non-emergent transport instead?
Good question. So, Christy, I'm going to assume that you bill on a UB04 or 837I because you know what the condition code is. For those of you that don't know what that condition code is, then you do not bill on a UB04 or 837I. Okay. And Christy, if the entire claim is just about the ambulance transport and you are trying to exclude the entire claim, feel free to use condition code 21. On the other hand, if you're billing outpatient services, because remember they have to be lumped into one claim for that data service, how do you differentiate if this ambulance transport isn't, but some of the other things may be medically necessary? And that's where you would include the modifier GI without I'm sorry, not GI, GY without the condition code 21. Let me just see if Aline has anything else she'd like to add to that.
Nothing additional to add. I think you hit it on the head.
All right, perfect. Any other questions?
Not at this time.
All right, well, let's go ahead and move on. Now, here's where our issue comes in at WPS. And this is what a lot of the questions are coming from with an ambulance supplier. So let me first say we're going to talk about modifier GY redeterminations. Redetermination is a level 1 appeals. The appeals process begins with the Medicare administrative contractor that processes your claim. Now, I do know that some of you are not part of WPS jurisdiction, and that's okay. You're welcome to listen in, but this issue may not apply to you. So I want to make that clear before we get too far into this. Okay, so what's the full appeals process? We won't necessarily get into that, but I am going to highlight a variety of different pieces of issues. Okay, so first, I was asked specifically about why you're receiving documentation requests when you did not request an appeal. This is an interesting one because what happens is you bill the modifier GY appropriately, right? You say, hey, this is not part of the Medicare transport benefit. The patient gets a Medicare summary notice. Now, this is part of their no pay notice. It is not issued monthly or anything like that. It's issued quarterly. Once they get that quarterly notice, they have the right to appeal that decision, and they can appeal it for any reason they want. They usually appeal with very generic statements, okay? And when they do that, we don't know what to do besides review the information that you have. But how do we get that information? That's what's triggering the additional documentation request, which is why this is built in. It is the patient's request coming in. Now, again, there's no form required, just like for you as a provider, there's no form required. The patient puts a very brief statement. It can even be written directly on their remit notice. And then the patient or a representative dates and signs it. So please note it has to be a representative of the patient dating and signing this or the patient themselves. You, as an ambulance supplier who filed that claim, cannot represent the patient on this situation because you have a financial or you have you are party. Sorry, that's the word that I was looking for. You are party to the claim decision. Because you filed it, it's part of your claim decision. Okay? So we want to make sure that we understand that. I was specifically asked if this happens with a GX2, and the answer is absolutely. So you've told the patient with the advanced beneficiary notice of non-coverage that this isn't covered. Not going to be part of the Medicare benefit package. The patient still says, I don't agree. So they send it in. No, they don't have to select an option. No, they don't have to sign and date and do all those steps. Not like that. GX doesn't need that. However, it does allow them to file an appeal, and they can say whatever they want. Aline and I can both say, hey, when we get redeterminations, sometimes the stuff we get in is like, wow, okay. They don't agree with how much you were paid. They don't agree with a variety of other things. That's why sometimes we have to look at them from a different standpoint. Okay, so in the case of a GY, though, what they're saying is we feel this transport is medically necessary, we being the patient or their representative. We don't necessarily know why it was billed the way that it was billed. So keep in mind that becomes part of the problem. When an ambulance supplier acts or files on the behalf of the patient, but the ambulance supplier or one of their staff members signs and dates it, this is no longer considered a patient request. So our appeals department gets this. They look at it and they're like, oh, this ambulance supplier, because of this signature and date, it is coming from that supplier. Therefore, they're indicating that this is a medically necessary transport. We simply remove the GY and process the claim. There's no medical review. There's nothing like that. So if the patient wants you to help them file an appeal, have them, you can even have a form, very nice form that they fill out. They check it. Yep, we want to file the appeal. Have them write a reason, whatever the reason is, and then they sign and date it. You can get that back in, give us a copy of the run sheets or whatever documentation you feel will support this, and send it in. It is a patient request because the patient signed and dated it. Want to give you one caution. If a representative signs and date it, please include that on there. So, right after the name, say representative, something like that, just so that our appeals team knows what's going on with that. Okay. So automatically sending in an appeal for the patient or on the patient's behalf, but with a date and signature from the provider representative means no appeal occurs. We simply remove the modifier GY. That is the current issue that we have going on. All right. Now, if the patient does file it, that's fine. We will send you additional documentation requests. What's the issue when you get an additional documentation request? People don't respond to these. And the people are the ambulance supplier because it does need to come out to you, right? So as the ambulance supplier, the ADRs come in a letter format. We are requesting information to decide whether or not it was medically necessary, and it will be reviewed by a medical review team. Okay, so no response equals an automatic Medicare overpayment with zero patient liability because you didn't follow through on the information. If you do send it back, we will complete the medical review. Then what will happen is we're going to make a decision. Yep, we agree with you, or nope, we don't agree, and we're going to overturn it, remove the GY, and let it process. Okay. So there's two issues coming from our redetermination or our level one appeals area. One, ambulance suppliers are filing on behalf of the patient, or they're thinking they're filing on behalf of the patient, but really they're not. And two, they're just simply not responding to our letters where we're asking for additional information. Okay, hopefully that makes sense and kind of goes back and forth with that a little bit and gives you the two issues that we are having. Now, again, that's WPS, not everyone. Somebody did ask, what are the levels of appeal? And I want to remind everyone, there are 5 levels. Okay. Level 1, in the appeals is a process. The levels are who conducts what. Level 1 is a redetermination completed by the Medicare administrative contractor who processed the claim. Level 2 is a reconsideration completed by the qualified independent contractor. They're hired by CMS to look at it from that point. Level 3 is completed by CMS themselves using an attorney adjudicator or administrative law judge. Level 4 is the Department of Health and Human Services using the Departmental Appeals Board. And level 5 is a federal district court. So you have to go through all the different steps. But it may not be you doing that. It might actually be the patient. And the patient has the right to do that as well. But again, theirs is a little bit different than yours. If you want to learn more about that, we do have a full set of information on appeals out there and available for you. The information is available on our website or in our YouTube channel as videos that are recorded. All right, this is one of the things that someone asked me about, and I think it's because the appointment of representative or GR, which is a form, appointment of representative form, is coming in very disjointed sometimes. And I think they're trying to use it. Not sure if it's valid for them or not, because can a provider be an appointed representative? Yes, just not for their own claim because they are a party to that claim. So they could work on behalf of someone else or another company for the patient, whatever the situation is. So if there is an appointment of representative needed, then there needs to be a CMS 1696. It is an approved Office of Management and Budget form. Okay. It is linked for you on the slide right here directly. Please remember that this is valid for 1 year or for all subsequent levels of appeal. The reason that they say or subsequent levels of appeal is because that process can take longer than 1 year. So they want to make sure it's valid for 1 year to start a new appeal or to start something else. But if you're in the middle of an appeal, it doesn't suddenly become invalid. Specific members of an organization or entity are named. That is true. You can't just say, hey, this entity can work on my behalf. Who is that person? That person can work on the patient's behalf. Again, they cannot belong to an organization or entity that already has an established relationship or that billed it, whatever. They have a relationship to the claim or the payment. An appointment of representative can be revoked at any time. However, I do want to remind everybody that it does automatically revoke upon death. Got it? So if the patient dies, it's going to stay in effect if there's an appeal in the process. So let's say it's on level 2, right? They want to go into level 3. Yes, this will still say, and please don't think it's going to go away. But it's not in play for anything new. And that was a very interesting question that I wanted to make sure got addressed because I do find that to be one of the tougher situations when people are unaware of it. Okay. So here's some just different links that might help you at the bottom. The Code of Federal Regulations, which is going to talk about appointment of representatives, and then Chapter 29 in the Medicare Claims Processing Manual, which talks about the appointment of representative for the appeals decision. And that's where I got a lot of my information from for the questions that y'all asked on that. All right, so ambulance providers. When a service is not medically necessary, an ambulance supplier can tell us that right up front. How do they do that? Again, condition code 21 works fine, but the issue that we're having is modifier GY, which is why that's what we're highlighting during this course. Okay, so the documentation does not support that. Then you want to append a modifier GY. Well, now you're going to do an internal audit and you find out, wait, this documentation really does support it. Or we missed something in the initial review. Now we shouldn't have billed the GY. This is where you should rebill it without the GY modifier. Or again, if you happen to be using the condition code, go in and correct the claim if you can. And if not, use the clerical error reopening or SIR feature on our website to remove the incorrectly billed modifier GY. This does happen, and I think what the person was referencing that led me to build this slide was that they have an auditor, and they're talking about an external entity auditor. So, okay, who came in and said, hey, you actually aren't billing these correctly, and here's what makes this medically necessary. That's your decision, and you can do that. But I will tell you again, don't just file an appeal on that. Why not? 2 reasons. First, level 1 appeals. So of the appeals process, when we start with level 1, which is the redetermination, you have 120 days. For a reopening, a clerical error reopening, you have 1 year. That date starts with a processing date, not necessarily a date of service. So you have a longer time frame for the clerical error reopening. Okay. Also, if you file it and you do the clerical error reopening, it doesn't take as long as a new claim to process. Sometimes you can process it immediately if it's taken. Okay. Why do we recommend doing the clerical error reopening in the portal, which is our online system, and we'll look at that in just a few moments? The portal will tell you whether our system will accept it or not instantly. That's why we recommend doing it there. So again, if you're appealing and you are signing and dating it as a representative of the ambulance supplier or ambulance company, then we will simply remove the GY. There is no medical review. There is nothing like that that happens because you're now saying to us it is medically necessary versus the GY, which indicates it does not meet the statutes. Okay. So hopefully all of that together makes sense with the issues that we're having and why we're looking at it. I was asked, oh, what kind of documentation should you consider sending if you do get an additional documentation request or you're filing on behalf of the patient with their signature and date? Here's a couple of things I always recommend. The assessment. What did the EMT look at? What were we kind of going through? What did they use as the starting point? The run sheet. That makes sense. What happened during the transport, during the actual transport? The physician certification statement and ABN if applicable, because you don't necessarily need a physician certification statement or an ABN. One of the interesting questions that we got relating to documentation is, does the document or does the destination information matter? They didn't use the word destination. They actually used the ER information. And the answer is no. How did you know the ER information as a destination? So you took him there. How did you know what the ER was going to find? How did you use that to determine whether you should transport or whether it was medically necessary? This is different than when you pick up at the ER or you pick up at a skilled nursing facility and you get a report from them. Well, the EMT knew that. So now they would need to tell us somewhere along the way, hey, we checked this report, this is why we did what we did, or hey, this is what we're going with that. Then they did use that information and it should be included. So there's a couple of resources again for some documentation stuff. Remember, PSC equals physician certification statement and ABN equals the advanced beneficiary notice of non-coverage. Oops. This slide is just built to remind you of the issues that we are currently having. The biggest one being the patient did not sign the request, therefore it is coming from the supplier and we automatically remove the GY because they are not party. They cannot be an appointment or representative. They are a party to the claim, so they are not someone who can be an appointment or representative. Now, that doesn't mean that you couldn't send it, like physically put it in the mail, fax it, do whatever you're going to do for the patient. Yes, you can do that. Yes, you can do that. The one thing you can't do is submit it via the portal because that is for provider submitted. We would not know that the patient is requesting it in that case. So hopefully all of that kind of makes sense. Let's keep going here. Someone asked about the origin and destination modifier. There's a note out there on our website that you don't have to append an origin and destination modifier when you are billing the GY modifier. Yes, that is a true statement. This causes issues though. If the patient files an appeal, you don't necessarily give us the origin and destination modifier, but you supply us with all the documentation. Now we will have to determine the origin and destination modifier based on the documentation, and if we cannot, we then have to come back to you and ask you for it. So we always recommend that if you're billing, it doesn't matter if it's GY or GX in this case, please just put the origin and destination modifier on there as well. Makes it a little bit easier should the patient ever come back and choose to file the appeal. Just a recommendation. Okay? We do get a lot of appeals put in for this purpose. All right. So that is about origin and destination modifier, which brings me to the last slide that I have. We'll go through some registration questions. Then what we're going to do, before we do this, I'm going to go through some resources because I was asked some questions on that. So I'm hoping that by hitting the resources, it will answer all the questions, and then I'll come back and go over the ones that I don't think I've answered yet. So let me do that first. So the first resource someone asked us about is something that I keep mentioning, and I keep saying this booklet, this information that is sent to the patient. If you're not familiar with the Medicare.gov website, it is the Medicare CMS website for patients. So unlike you guys who get to use cms.gov, medicare.gov is for patients. If you're not familiar with the handout or the booklet that I'm talking about, go to the basics right here on the top and you'll see it on the right side. Kind of move in a little bit, it's 5 links in, and then go to resources again on the right side. It's the third one down and there's the handbook information. You can always download a copy of the handbook by simply scrolling down to the body under the picture and you download the PDF version. Okay. If you hit Control F, you can find something within it. I like to search for ambulance just because I think it's easier. It'll tell you the page numbers. Now Control F or Edit Find just keeps moving me through. The reason that I like this is that it's written for CMS beneficiaries. Okay, it's not necessarily written or geared towards you, but it does explain everything that I just kind of went through at how CMS explains it to them. It's just a great resource for y'all to be aware of, if that makes sense. Um, I'm going to go to the cms.gov website next. Oops, I'm in the Ambulance Service Center all the way. So this is just the Ambulance Service Center. So if you come to Medicare and you go to coverage, when you're in coverage, you will see the Ambulance Service Center on the left, I'm sorry, on the right side on the bottom, which is what I'm actually in here. It's just an easy resource for you guys to get everything you need from CMS. Because I've mentioned the ABN, I was asked where to find information specifically on that. That's not going to be in your Ambulance Resource Center. That is in the Medicare website. That is going to scroll down and we're going to go to Forms and Notices right here on the left side. You will see it change on the right side and you're going to go to the third one, which is Beneficiary Notice Initiatives. And there you'll have all about the beneficiary notice initiatives. On the left side, you can see fee-for-service ABN. That's the advanced beneficiary notice of non-coverage I was talking about. Please take note of the March 13th update, which says that, hey, we know this is expired and you can use the old ABNs until May 12th, which is already gone. And then you have to start using the new ABN. If you're not familiar with that and you want to download a copy, take a look at it, scroll down and you can do that right here in this zipped file. Some changes, different things happened with that. We'll learn more about that if you want on yesterday's webinar, which we do have an encore available also for you. So again, if you give this form, this ABN form, you're going to bill a GX. If you do not, you will bill a GY. Okay. So hopefully that answers those questions. A couple people did ask us specifically if we have guidance, and we do. Our guidance is actually available, and I'm going to use the Training Center to show this to you. So it's the WPSGHA.com website. Go across the top, go to the middle link, and it's called the Training Center. When we scroll down in the Training Center, and I want you to pay attention to the left column and go to the very last item, this will be specialty/services, training and resources. When you open that up, the very first one is ambulance training. What is great about this page, I showed you a bunch of different pages and went through a bunch of different items. This page will link you to any of that plus more. So it'll link you to a variety of CMS pages and WPS pages. So I really do think this is a good tool if you're trying to move through everything and trying to figure out what you need. So hopefully that makes sense and I got all of those different resources that were asked for in the registration. If you want more resources or you need a specific question answered, I do need something in the chat so that I can get to that. We're going to go back to the PowerPoint at this point. We're going to answer those registration questions. The couple that I still have. How do you bill if a patient or representative insists on ambulance transport? That's exactly what the GY modifier is for. They can insist on it, but you did an assessment as an EMT and you found, hey, this is not medically necessary. There's no way this is going to meet medical necessity. My favorite example of this came from an EMT who said, I got called out. The patient was complaining of stomach pain, etc. Turns out they had to have surgery and they were up walking around backpack, but they needed a ride to the hospital. Okay, so they got there, the EMT did the assessment. They weren't in any noticeable pain. They could have sat but there was no one to take them. So what they did is called the ambulance. They then gave a basic definition to the dispatcher, who then dispatched for that reason. This is exactly what a GY would be used for. Again, if you do give an ABN, then you want to use a GX. You can use the condition code. What situation for ambulances would a GY modifier be applicable? And I want you to refer back to section 1861 S7 in the Social Security Act. That's when it's applicable. If it does not meet that definition, because again, that definition does include the word contraindicated or only safe means of transport and transport. So it has to meet those two parts. So the patient transport has to occur first, and it has to be the only safe means. If not, then yes, a GY would be applicable unless you gave an ABN, in which you would use a GX, but they're really interchangeable. All right, a couple more. One, I was asked about the quit living modifier, or QL. The quit living modifier was a catchy phrase that someone used a long time ago that really stuck in my head. So it's the QL modifier and how to get those calls paid. The QL modifier should not be used with a GY. The QL modifier indicates that in transport, after you were dispatched, upon arrival, the patient was deceased. So you were dispatched to what you expected to be a living patient that would need a transport, except you got there and they're not. Okay? I'll give you an example. The patient has a heart attack and dies in their recliner. The patient has been dead for 5 days. You are dispatched to a heart attack. That's literally what the person on the phone calls in. Oh my gosh, they had a heart attack. So you go believing you're going to treat this patient for a heart attack, and you get there and you're like, oh, wait. That would be an example. But don't bill the GY. You want to bill the QL, and with that, we don't look for mileage. We only pay a base rate. The next question is appeals versus reopenings versus void. I talked about appeals and reopenings. Now, voiding is something that is done within the Medicare claims processing systems for UB04 and 837I claims. You can actually avoid, or you can actually void the claim. You say, oh, no, this isn't valid. In terms of the 1500 or 837P, you must return money to void a claim. So the difference is the process that goes through. Again, appeals is the formal request to review a claim. A reopening is an adjustment for a minor error or omission. This is not the formal appeals process request. And the void is, hey, you either entered the system or you sent us money back to say this claim isn't valid. With that said, let's move on and go to the chat. Any questions in the chat?
Hi, Tom. We have a question from Cassandra. She says, if a patient could be transported by wheelchair van, but EMS is scheduled to transport, would a GY be appropriate?
Yeah, actually, Cassandra, that's a great example of when to use the GY. You know, when the EMT gets there, when EMS service gets there, they do want to do an evaluation. We always need some form of that, and that evaluation could be quite simple. Hey, they can stand, they can pivot, they could safely sit in a wheelchair. Yeah, they need help standing, but there's no reason they couldn't sit in the wheelchair. That would be a reason to use a GY. So yeah, I would completely agree with that.
Thanks, Tom. This question comes from Rita. She says, are we required to bill no transports since it is a statutorily excluded service? And then she goes on to say, we do have the patient sign an ABN, understanding that Medicare will not cover.
All right, let's talk about that in a couple of different portions. First, are you required to bill it? Here's a little bit of a long-winded answer, and I'm sorry that it is a conditional answer. First, Medicare does not require you to bill this. This is not a service that we will pay for. On the other hand, if the patient says, I want you to bill Medicare for that, now the patient requires you to bill that, and because this is their benefit program, yes, you have to bill it. This could also apply to something for a like a primary insurance situation where there's someone paying, where Medicare is primary and there's someone paying after us that needs it. Medicaid is an example. So yeah, you may need to bill it just depending on the situation, and you would bill the treat no transport code. CMS has indicated that they feel like the treat no transport code should be billed with the GY modifier. The reason that they do that is the treat no transport code and a variety of other codes can still go through the medical necessity edits, and they really don't have a reason. The GY and the GX don't do that. They just automatically stop and say, "Yep, okay." But what they will do is append the patient rights. So sometimes that's why a patient wants it to be billed. Now, as I stated earlier, you say we do have the patient sign an ABN. You do not need to have them sign an ABN. Let me go back to that form, and I just want to explain this statement. So I'm going to go back to the CMS website, and I'm going to go back to that beneficiary notice initiatives area. I'm actually going to go ahead and open up the ABN for you, and so we can take a look at it. So you got to give me a second because I did not have this opened in advance, and I will apologize. This is a zipped file. I'm just going to throw it on my desktop here. And the zipped file simply means it's compressed. It's made smaller. So let's see, what do we got? When we compress the file, it then opens up in my file explorer. It might work a little differently depending on what compression software, but most of them will actually look very similar to this. You have a variety of different things that you might want to look at: Spanish, English, large version, not large version. Let's just go ahead and grab this fillable PDF or the non-fillable PDF. Either one is fine. All right. Sorry, can take a second. Here's the form. What you do if you use this as an optional form: first, patient name and identification number. Patient name is required. Identification number is not required. You can use it, but you would want to put whatever your identification number is. Notifier name, address, and phone number. This is your company, so the patient can identify you as the ambulance supplier. If you notice, one of the things that did change was there's no line right here. Also, item test service, this paragraph changed so that you don't have a blank you have to fill out. You're providing a service, so there we go. This could be the ambulance transport or treat no transport, whatever the situation is here. In this case, I believe it was a treat no transport, and please correct me, Aline, if I'm wrong there.
No, she said no transport.
Okay, so the reason Medicare may not pay, not part of your benefits. That's why you're not going to pay. What do you want to put for your estimate? What would you bill if someone didn't have insurance? That's your private pay amount. That's your typical amount that you're going to bill for this service, okay? That's kind of giving you a little bit there. Don't need to break it up. You don't need to say, hey, your supply is going to be this and your treat's going to be this. And no, just give them one lump sum. That's fine. CMS does allow that. Makes it a lot easier for the patient themselves. From there on out, the rest of this form does not need to be completed. Okay, you're using it for an optional portion, which is just this top part. That's actually in the CMS instructions. So you can make them do all of this, but what if they select this option when really what we're trying to do is get them to do this option, right? Don't even need to do that. You just want to give them the form. Now, once again, do you need to give them the form? No, you didn't transport them. Let's go back to that Medicare and You guidebook that we looked at. And inside the Medicare and You guidebook, what do we find? Medicare covers ground ambulance transportation. What's this word say? Transportation. So again, they're already told if there's no transport, Medicare doesn't cover it. This is why CMS doesn't require you to bill it unless the patient asks you. And I'm sorry, I know that was a very long-winded explanation, but I wanted to kind of tie it all together. If you're interested, you can look at the Social Security Act in Section 1861S7 for that. Also, in the Medicare area, go back to cms.gov. You can take a look at Medicare and you can take a look at the regulations and guidance. Inside the regulations and guidance, I want you to go to the manuals and the internet-only manuals right here. Once we're in the internet-only manuals, we're going to go to the claims processing manual. And we're going to scroll down a little bit. We're going to scroll down because what we're looking for is the financial liability protections. Sorry, I couldn't remember the chapter number, but it is chapter 30. Inside chapter 30, you'll see a whole bunch of different things that apply. One of these areas will tell you when it's applicable, which means you have to use it, you must use it, however you want to say that, and when it's optional. Optional ABN use 50.2.1, when we select that, what we find out is section 1861. 1861 is an optional use. So that hopefully ties it all back together when you use the form. And then if you keep reading through this, it will define for you a lot more information. But I just wanted to show that to you and tell you why it's optional and where you get that information from. Aline, anything else?
Yes, we have a question from Abby. She says, EMS shows up to the patient and CPR is in progress. EMS continues CPR efforts, but the patient expires and they don't transport. How can we bill this?
That would be a great example of using the modifier QL. You didn't transport because the patient expired. Like during sometime during that, before the transport, the patient expired. What you will get paid for is a base rate. What you will not get paid for is mileage. Why? Well, you didn't put them in the ambulance and drive them anywhere, so what mileage are we going to pay for? And remember, when you look at Medicare's benefit, we have to have the loaded mileage. That's the terminology CMS uses, is loaded mileage. So Abby, in your example, you just spelled out the perfect example for using the modifier QL on a base rate. Aline, anything else?
There are no further questions at this time.
Okay, let's go back to the slides and talk a little bit about this survey. We want to thank you guys for attending, and we want to remind you that we're actually going to have you guys take a survey. A couple of things with this. I'm going to have Aline put a link in the chat for you so you can take the survey right now while I'm talking. I'm also going to go ahead and have the survey come out when I close this webinar, or when you close the webinar, and that's going to look like the upper right side. It's just a little pop-up box. This is not spam or malware or anything else. It is actually a CMS survey, and you notice that's indicated with the highlighted destination site. CMS starts with CMS, then it's Mac, Fed, Ramp. That is their survey. The company they use is Qualtrics. We do view this survey, and so does CMS. Now, we want the survey so much that we're going to give you another opportunity to take it if you haven't taken it, and that is to take the survey via the email or the follow-up. We'll talk more about that in just a little bit. Also, if you're watching this as an encore presentation or any of our encore presentations, you're going to see a picture on the right side on the bottom, and it's got a little finger pointing to the top line. It gives us 5 stars. That indicates that there's a survey available for a YouTube video or for any encore presentation. So a variety of ways to take that survey. What are we looking for? Honest feedback. What did you like? What didn't you like? The survey is 5 questions and then an additional question saying, hey, do you want to give us more feedback? You can say no and you're done. You can say yes and go through the remainder of the questions. So it's pretty fast, but we really do ask that you take the survey, give us that feedback, and help us. All right. I know this slide says is not. I'm sorry. I know this slide is not in your PowerPoint slides. We will soon be posting the National AB Mac Ambulance Provider and Supplier Coalition meeting. This session will give you some information that we're going to go through next month as well. And we're going to go through it based on our information and what we have for findings. But this one is all Medicare administrative contractors coming together that receive ambulance claims. This one is September 16th from 12 to 2 Central Time, 1 to 3 Eastern Time, and you can actually register for it. Now, I want to remind you, it's not quite on our website right now. We still are waiting for that update to occur. You will be able to do that, though, shortly, hopefully within the next week or 2. So I wanted to give you that. Again, remind you, this one's not in your handout. It's just kind of an FYI for you. When you are looking at this and you do receive an overpayment, please take time to consider doing the overpayment via our Secure Net Access portal. The overpayment can be done as a request, which means we're going to ask you for money back, and that's the overpayment claim adjustment, or you can simply refund us the funds. The reason that we're asking for you to consider doing this is that on the paper form, there are 3 areas across the top that are jurisdiction, that our Part A or B of Medicare, and also the state in which the service. We are not getting this filled out correctly. And because this is being filled out incorrectly, it's causing us issues in our overpayments area. Also, it's causing money to be taken back that should not be. So again, take the opportunity, really look at using the SNAP or the Secure Net Access portal. All right, let's finish up quickly after those couple of announcements. Oh, I forgot this one. If you do file a Part A redetermination, we are going to stop sending paper letters if you file it via SNAP, and we're going to put your letters in SNAP. There's a screenshot for you to help you. Again, I apologize. I forgot to mention that update as well. All right, with that said, that brings us to the end. Here's a couple of things I want you to be aware of. First, I'm going to send you an email. Well, I'm not going to do it. Our system's going to send you an email. Keep that email. You want to open it up and take a look at it. On the bottom, you will see contact hours for 1 hour for this course. That translates to CEUs. So we don't actually offer CEUs, but governing bodies might accept that. Number two, if you have questions, and including the link to register, which I see Aileen just put the Ambulance Coalition for the September 16th event directly into the chat. But if you do want that link and you want it right now, please feel free to email us. It is follow up to this event. So what I would like you to do is email us at wps.gha.education@wpsic.com. In the subject line, again, include ambulance and modifier GY, or ambulance modifier GY, something related to that, so it gets to us, so we can answer the question. We'll get you that link. If you dialed in and you do need a certificate, please know our system cannot automatically do that because you only dialed in, doesn't have your email. You will have to email us at the same email, include the same subject line. Give us your 10-digit phone number that you dialed in from, and if we can verify that with our system, we will send you a certificate. Otherwise, you will get the certificate automatically. All right, that's it, everybody. I want to thank you all for attending, and thanks for your time today. Please remember to take that survey and sign up for those additional webinars coming soon. Continue to watch through the end of the year. We are planning to continue our ambulance series at least through the end of 2026, approximately one a month. On behalf of myself and Aline, thanks for joining us. Please take time to take that survey, and we look forward to seeing you at future events. You may now disconnect, and y'all have a great day.